It's Sully and Russ on the Big Biz Show.
Jim Traficant is here. He is he apparently has been at the forefront of the health IT transformation, which I don't really understand.
I don't either.
I'm going to let him talk about that. Jim, welcome to the program.
Hold
How
on,
are you?
Jaime.
Thank you.
So tell us, investment guys, what is health IT in the first place?
The elevator speech.
Health IT is taking healthcare where people walk into a hospital with a box of paper and CDs under their arm and making it electronic and secure so clinicians can get that information electronically.
So, but the HIPAA compliance, so everything is at your fingertips, is what you're saying.
Yeah, and it's got to be secure. That's what we're doing.
Oh, I see.
Yeah.
Well, because over the internet, that could be hacked and all that stuff. So you're saying actually you have something like a thumb drive, literally, of all your history, your medical history.
Actually, what we're saying is that where your information was created, either in your doctor's office, in a hospital, wherever you went, we will access that information and deliver it to wherever it's needed so you can get better care at a lower cost, and we do it all securely.
That's a better idea than mine.
I like your idea. That was a good idea.
Yes. That's good. Hey, he's a Federal 100 award winner. That's a lot from coming from.
Work with me, Jimmy.
That's pretty good.
Right.
You're with Harris, and you have developed within Harris a healthcare solution division. Is that about right?
Yes.
Let me ask you this: how's it working with the Department of Defense and the Department of Veterans Affairs?
It's getting better. We're connecting them. And the important part is we're taking better care of wounded warriors. You know, these conflicts, people are getting hurt, and we need to be providing care. And what we're making possible is that care could shift from the DOD over to the VA. And we also know that over half of all care, this is something is not widely known, over half the care for active duty and retired service members comes out of the private sector. And until now, there was no way to connect them. And so that's what we're doing. We're making it interoperable, making that information connected across the DOD and the VA, and then to your local physician or hospital.
That's got to be helpful because doctors don't know how to write. You know, you ever get scribbling, they prescribe the wrong medication or something?
But isn't there a mandate for things to be digital at this point?
Yes.
So when did that go into effect?
Actually, there's incentives put out through the American Recovery and Reinvestment Act that by 2011, right now you've got to be able to practice medicine using electronic health information. By 2013, it has to be connected to other health enterprises. By 2015, you have to be able to do quality reporting. How are we doing now that we have all the system information out there? Are we doing it better, more efficiently, and providing better care? All that stuff's being mandated in the law right now.
Right.
Lucky you. Yeah. You're all set. You're in hog heaven now with that mandate.
Exactly.
You know what, though? But I earned my way. I was a patient in this system for a long time. I've had 2 liver transplants. And I had an Army Lieutenant Colonel, retired Army Lieutenant Colonel Frank Finelli, risk his life for mine in a living donor liver transplant.
Wow.
As a result of that, that's why I'm in healthcare, and we're determined to make a difference here.
That's
for the
great. That is motivated.
You know, our guest is Jim Traficant. Jim is with Harris. He's developed a healthcare solution division for Harris Corporation. And Harris Corporation is a company with a long history of technology, communications, and such. Let me ask you this. Where are we going to be at in 5 years, Jim? Is this something that's going to help the average worker as well as the wounded warrior?
It should help everybody. This connected information, the cost of healthcare is hurting us as a country.
Right.
We've got the quality's not where it needs to be. When you walk into an emergency room today, they start from scratch trying to figure out what's wrong. What we're going to make possible is your information will show up when you do. It'll all be secure. We'll have situational awareness, just like we create for the military, the FAA, for broadcasters. We're going to do it for medicine.
I guess where we're heading here is that pretty soon we're going to be able to walk around with a USB stick. You know, walk into
that was my idea.
Yeah, well, but you're gonna be able to have all your new information automatically downloaded wirelessly. I mean, isn't that where this is all going?
Yeah, the information is going to come from wherever it was created, and then we will be able to securely deliver it wherever it's needed. And that's not just Harris, but that's where the industry's headed. Yeah. And the country needs this. We're spending way too much money. We're not getting a return for it, and we could do better.
Tell me what kind of cost benefit is this going to be for us?
I'll just give you an example. Social Security used to take 83 days on average to find the health information to determine benefits for somebody. When they go through this connected framework that we created for the federal level, they went from 83 days to 24 seconds.
Oh, that's a big savings.
Wow.
That's a big deal. They're
That
spending
is-
about $500 million doing it in paper, and we should be able to cut that dramatically.
What's the time? What, Jim? What's the time frame?
We're doing that today. That's actually
So right now. So what about adoptability time frame? How long before everybody's on a system like this?
the government's motivating everybody to get there by 2014. So the incentives are there. They're helping people to convert from paper to electronic health information with health records. That's going on right now. It'll probably take 4 or 5 years, and it might be a little bit longer before everybody has it, but it's happening today.
You know, where can people get more information, Jim?
You could go to harris.com/healthcare.
Okay.
You could also go on Health and Human Services website. There's a lot of information there.
All right, very good. Jim, thanks so much.